much for joining me today on the podcast. I'm excited to chat with you. For those who don't know David, he is the president and CEO of the Medical Fitness Association. He has about 25 years of experience in the health and wellness industry. But David, why don't you give us a little background on yourself? How did you get to where you are today in the industry?
Yeah, thanks, Taylor. First of all, thanks for having me on, and I'm honored to be here. So yeah, I am the president and CEO of the Medical Fitness Association. We are a professional membership organization where we work with facilities all across the country that are looking to integrate more closely with healthcare. And my background really has been centered around the intersection of fitness, healthcare, operations, and over time that's really evolved into helping define what the medical fitness model looks like in practice. So at MFA, a lot of our work is around standards, education, helping operators move beyond traditional programming into more structured prevention and chronic disease support. I have a personal background in exercise science as my bachelor's degree and went on to get a business degree, master's, and worked in medical fitness from the first part of my career. Spent about a little over 20 years in the management and leadership of medical fitness centers, and I've always been involved with MFA. And from a early point of just going to some of the events, the conferences, and then starting to be on committees. I was on the board, ended up being the board chair, and then about a little over 5 years ago, I became the CEO. So it's really been fantastic and an honor to lead this organization that I've been part of for so long now.
Yeah, it's really cool that you were a member for so long and now you get to lead it. You have that experience of what it's like to be led by, and now you get to lead. So that's really unique.
It helps to have seen for so many years what a MFA member experiences from the member side to really try to position the organization to support our members in the right way and things that are important to them. I think at a high level, we focus on helping define what medical fitness actually looks like in practice, not just what the ideas are, but really the structure behind it. So a long time, I would say that fitness and healthcare have been really only connected conceptually, not so much operationally. And so what we're seeing now is that shift towards fitness facilities playing a much more defined role in prevention, in chronic disease support, long-term health management. That's really where a lot of our work at MFA is centered.
I'm glad you brought that up, because when I first started at Club Solutions and I would get assigned stories about medical fitness, I would be confused on what actually medical fitness fully entails. Is it insurance-based programming? Is it chronic disease-only programming? But then there's medical fitness centers. What does that mean? So for our listeners who maybe don't have the best understanding of it, what's the definition from your point of view of medical fitness, or what's that structure defined as?
Yeah, that's a great question, because I think for years there has been some misunderstanding, or maybe there's just been multiple folks defining what it is and what it means to them. I think another term that's used in so many different ways and maybe misunderstood, but it's related, is our clinical integration. So all of this kind of goes together, but I would say the medical fitness model is really a framework for designing sustainable medical fitness programs by really aligning 5 elements that I look at. So clinical pathways, referral infrastructure, program operations, and then the financial model to it and how it's sustained, and then really measuring outcomes. There's many components, if you break it even further down, of what the medical fitness model is. A lot of times on the operator side, when I was running facilities, I would talk about our professional staffing and our clinical fitness programming for various populations and our medical oversight, our emergency response and safety preparation, outcomes tracking. A lot of these things really are part of what the model's intended to work on. And when these components are working well, I would say that really then the model can help a health system connect their traditional care with what we can offer in long-term health, wellness, prevention, and lifestyle and behavior change.
Yeah, awesome. Thank you for that. I think clarification is always important in this industry because, like you said, everyone kind of makes their own definitions and no one is always aligned sometimes. But I know that MFA, we're going to call it that moving forward for the listeners. MFA is just short for Medical Fitness Association, has been championing the space for years. From your perspective, what's the single biggest shift that you've seen in how the industry is really thinking about the relationship of fitness and healthcare?
Yeah, that's a good question. From my perspective, the biggest shift really has been moving from fitness being adjacent to healthcare to starting to become more of part of the care continuum. So I'd say historically the industry's positioned itself as supporting health and wellness, which is important, but still somewhat outside of the whole healthcare system. So what's changing now, I'm seeing in many areas, is a growing recognition that long-term lifestyle and behavior change, which is really what can ultimately help drive health outcomes, doesn't really just happen in a physician's office or in the healthcare hospital walls. It really happens in environments like medical fitness facilities and fitness facilities in general. So I think the conversation has really shifted from how do we complement healthcare to how do we actually integrate into it in a meaningful way. So I sum it up by saying we've gone from really being a nice add-on to becoming more and more of a necessary extension of care.
Yeah, I totally agree. And I have this bird's eye perspective of the industry. I'm not in it every single day running clubs. But I think I've noticed this shift since the COVID-19 pandemic. While it was awful on many fronts, it has pushed the industry to think more of the health aspect of fitness and rebranding ourselves to be part of that continuum of care, part of serving the whole person, not just, oh, we're here to lose weight. It's really how can we help people live healthier lives? And I think that has been one positive of the pandemic that we've witnessed.
Yeah, I agree. That's really good insight. I think that across the board, people caring more and more about their health, and we have to recognize that's what the public, that's what our communities want, and be able to serve not just, and man, this topic, people have talked about it for years, is serving more than just the 15 to 20% of the population that's athletic and in great health and just making their health and fitness better, but really serving the entire population who may be coming from a completely sedentary position and intimidated and not having chronic conditions that they're only being managed partly, and the fitness industry is positioned to really support that so much more. So yeah, I completely agree with that perspective that you have.
Yeah. For club operators who are interested in moving into this medical fitness as the industry's getting towards the whole person and focused more on health overall, if they don't know much about this space, where is a good place for them to start? What would be first steps for them from your perspective at MFA?
Yeah, I think this is where a lot of operators get stuck because it can feel like you need to overhaul your entire model. And in reality, I think the best place to start is much more focused. I usually suggest 3 main things. First is pick one population or condition to focus on. So whether that's diabetes, cardiac, oncology, brain health, orthopedics, or just an area that is relevant and important in your community, and focus on that. And then second, I would say it's build one relationship on the healthcare side. Even if that's just a single physician, a single doctor's clinic, but build one relationship. You likely have some passionate physicians or other clinicians that are working out on a regular basis. That's important to their lifestyle. There's the new specialty, relatively new, of lifestyle medicine. Those folks, I would say, in my experience, tend to walk the talk as much as any clinician does. So you're probably seeing that. So build that relationship, at least one of those to start with. And then third, I would say really work on and make sure that you have some level of internal credibility. So meaning trained staff, defined structured programs, and at least some basic outcome tracking. So the mistake I see is really when facilities are trying to do too much too quickly and implement the entire model straight off the bat. It takes time, but I think a better approach is really to solve one problem well and build from there.
Yeah, you mentioned forming these partnerships, and we recently did a thought leaders on medical fitness, and one thing that the panelists on there said the most is that physicians want to see outcomes. That's how they're going to trust you, is that you're actually proving outcomes, that your programs are making a difference in their patients' lives. What advice do you have on maybe how can people really show the results of these programs?
Yeah, that's a really interesting point. I think you can look at it in a few different ways. Some physicians, they really feel like they don't have the time to read through a bunch of detailed notes. So I'd say keeping notes simple and observations pretty focused that you're reporting back or reporting on in general, and make them and get that feedback to understand what particular physicians want, overall health systems want. And we can talk about tracking outcomes in multiple different ways. We can talk about it at the individual level from their health and fitness metrics. We can talk about it from a program level overall, and so aggregate health outcome data summarized together, showing one thing I can remember we did. We had a great program at one of my facilities where we showed a decrease in blood pressure levels after just a 12-week program that were similar to what typical medication for high blood pressure would do in that time period as well. So we were able to present that type of overall program data to our physicians, and that had a really strong impact. But then even into outcomes tracking for statistical and financial information is important, especially on the organizational side. So if whoever you're reporting to understands that this program is financially viable, that's part of it as well. So I think there's so much that can go into that. Some physicians want more information than others. Others want to make sure that they came to their initial appointment and have been coming regularly, and maybe some other stats. Others want a little bit more. So that's where it's building some of these relationships become important. The other thing that I would say about outcomes is really use them to make your facility and your program better. So tracking things at an overall level, evaluating and analyzing them over time can really help improve it over time. You're going to learn things. We learned things many times in our facility that if we would have kept our program the same 3 years later, we would have not been nearly as successful as we had been if we continued the quality improvements that we did over time.
Absolutely. I think the industry has more data at our hands than we ever have before. So really using that as a benefit than not just stowing it away in a file cabinet. Oh, here are the numbers.
Right. The worst thing you can do if you're actually taking the time to track outcomes is to not doing anything with it.
Great advice there. David, what are the most common integration challenges you see that operators run into, whether that's staffing, liability? I know that's a lot of operators' concerns, or building relationships, which we touched on there. What do you think is the biggest challenge when it comes to integrating medical fitness?
Yeah, integration has lots of different challenges, but I would say most that I see aren't really about equipment or the facility space, integrating those anyway. It's more on the relationship side and structural. On the staffing side, a lot of facilities don't yet have team members who are trained enough or positioned to work with some of these more clinical populations. And so there's a lot of different ways to attack that. We have a variety of really good accredited certification programs and related continuing education work that can really position people a lot more strongly on the staffing side. Because there are some considerations. The worst thing you can do is handle something wrong and that get back to the physician who just referred a dozen patients and now feels, wow, I don't know if I can trust these guys. Getting people on the staffing side who are really able to handle this. And to some that sounds more difficult than it probably is. There are a lot of really good ways to go about that and a lot of people who are interested in working in these settings. I would say on the relationship side, though, there's often a lot of uncertainty around how to even approach healthcare providers, physicians, and others, what those partnerships should even look like. I think that's where when there's a credibility gap, healthcare organizations don't know who they can trust because really there hasn't been widely adopted a consistent standard across the industry. So at MFA we have our facility certification, but I would say that hasn't been applied as broadly as it could be. So while that's one way that we can help with closing these gaps of credibility and increasing trust, we talk about that a lot. But I think a lot of times people assume that the barriers to clinical integration are financial or operational. And while there are some elements of probably, if you're not in that space at all, where you need to change some things operationally, I'd actually argue that the bigger challenges are more about building the trust, building the structure, the overall alignment.
Absolutely. What other ways is the Medical Fitness Association helping operators navigate these challenges or learn more? How are you a resource to the industry?
We do quite a bit about trying to bring our members together. I would say we prioritize multiple touch points in person and virtually. So a lot of our conferences, we have some really great subject matter experts that are presenting on topics that are really important, timely, but I would say the other component of that is the networking that happens and getting together with your peers who are working on similar programs and similar challenges, and I think that's where I see a lot of the great benefit happening from that standpoint. Now, there's also, MFA has done our facility certification for almost 20 years. That's built off of our standards and guidelines publication. And so those are, the publication I would say is an excellent resource for really understanding a lot of the details of the model and getting into some of the core areas in more depth. And then really, as people start to use those best practices and implement the guidelines within the model, if you are taking the next step, it is becoming certified. So that's another big resource that we have to set the stage for how to build that credibility. And we think what we're seeing is it used to be that a lot of this was really focused on hospital-based fitness centers, those types of medical fitness centers. But what we've seen more recently, or the last several years, is interest from outside of just the hospital-based ones. Your commercial fitness centers, rec centers, YMCAs, etc. A lot of them, some have even got certified recently. There's also, I think, been a misunderstanding that it's a model that's limited to our hospital-based facilities, and that's just really not the case, and we've seen that play out recently. I think while they are a strong group of our membership, we're seeing more and more interest from outside of that hospital-based, and people seeing this model as something that they can increase their credibility and tap into some new populations that may not have been their focus, or those folks maybe didn't think that was the place for them.
Yeah. I also think it's an opportunity for fitness facilities to differentiate themselves, right? I feel like the market is getting more and more saturated, which is great. I think that there's room for everybody to play in this industry, but having this accreditation, having yourself positioned as a medical fitness facility, that really differentiates you from the competition.
Absolutely. I couldn't agree more, and that's actually a word that I use really often with our certified facilities, that really, if they're new to being certified, one of the things I always advise is really make sure you promote that message out there, but not only that you are certified, but what that really means and how that can help people in their health journeys.
Absolutely. David, if you and I were having this conversation again in 5 years, what does a thriving medical fitness ecosystem look, and what needs to happen between now and then to get there?
Great question. Try to get out my crystal ball, but I think if we're having this conversation again in 5 years, I think that a successful medical fitness ecosystem looks much more structured and much more trusted. And that's the optimistic look at some of the positive steps that are being taken both within our industry and overall in the national healthcare world. But I think you'd see the standards, especially a lot of that we're putting forward, adopted more comprehensively across the industry and more defined referral pathways between fitness facilities and healthcare providers. And I think you'd see a workforce that's even better trained to support these clinical populations. So facilities then really would be recognized not just as a place for general fitness, but really as extensions of the care team, and especially for prevention and long-term chronic disease and condition management. So I think to get there, really we do need more consistency, more documented success stories. We need stronger alignment between the fitness and healthcare sectors in general. So I think FA is an organization where we see our role as helping to define that structure. And so I think if we're continuing to do some of the work that we vision possible, we want that structure to scale. We want our standards and guidelines, that publication, and our facility certification to be two prominent ways that we've provided a structure, a model that can scale. And so I think there's much more work going on in the background. We're further developing things and promoting them. A couple new things that we have. One is our brain health program accreditation. We're working on one for exercise oncology and cancer. So I think there's a lot of ways that this can keep moving forward and have a real positive impact on both the fitness and the healthcare industries.
Okay, I'll make a note for April 2031 and see if your crystal ball was correct on that, but I agree with where you're coming from. David, those are all the questions I have for you today. Is there anything that you'd like to talk about that maybe I didn't touch on?
No, I think we covered quite a bit of good things. I would say, just as some final thoughts, I think the biggest opportunity in front of the industry right now is to move from talking about impact to actually proving it in a consistent way with a structured model. And so I think the demand is there. Healthcare is actively looking for partners who can help extend care beyond their clinical settings. I think the question now becomes, can we organize ourselves in a way that builds the trust and delivers these measurable outcomes that we're talking about? Because if we can do that, then medical fitness isn't just a program, it's not just an incremental opportunity. I think it really can fundamentally change the role that fitness plays in the broader healthcare system.
I couldn't agree more, and I have witnessed firsthand that when the fitness industry gets together and puts their heads together, we make some real change happen. So maybe 2026 is the year we get this going.
I love your optimism. I share it because I do think we are just at this perfect position where healthcare really does need us now, and we're looking for ways to serve broader populations.
Well, David, I have a segment for you to have a little fun. It's something we want to start doing with all of our podcast guests, and it's called Hot Take or Hard Pass. So I'm going to read you 4 statements, and you're either going to say hot take, which means you agree, or hard pass, which means you disagree. And these are all about medical fitness. You ready?
I'm ready.
Medical fitness will outgrow traditional gyms in the next decade.
Ooh, outgrow. So we're talking growth percentage.
Yep.
Yeah, there's some nuances to that question, but I'll go hot take.
Okay. All right. If you're not measuring outcomes, you're not medical fitness.
Ooh, I'm gonna have to go. I'm gonna lean way more to the hot take on that side. Yeah, outcomes are so critical.
Okay. Physician referrals are overrated.
Hard pass, hard stop.
Yeah, hard pass. Yep.
Hard pass.
And then last one, prevention will drive more revenue than treatment.
Oh, there's a lot of revenue in treatment on the healthcare side. So I don't know that I can say the prevention has, maybe not yet, and probably not for a while, the opportunity for more revenue. It does have opportunity for very good revenue if done in the right ways. So I'd lean a little bit more towards the hard pass.
All right. David, do you have a hot take about the industry that you'd like to share?
The hot take is, again, that we're in this really good position where I see a lot of the things. You can look at some national policy and programs that are coming down that are on the healthcare side that integrate lifestyle medicine and healthy behaviors. You've got the Maha Elevate program that's coming along, the assessment reimbursement now that's available for physicians who do that. So a lot of these things are pointing towards what we've observed happening, so now policy is starting to match that. And so I think that's an important thing to keep our eyes on and see how we can have meaningful contributions to those movements and those things that are happening nationally. And so I think at the same time, a lot of the pressures that are on hospital systems. I was just on a call yesterday with a hospital CEO that was explaining some of the really challenging environment and things that are coming their way. So I think it's all coming together where it can be a perfect storm that we take advantage of this opportunity and be a big part of it. And so I think we're at that inflection moment where can we align on some standards and a model that makes sense to the healthcare industry and really be part of it in a meaningful way that helps with the clinical pathways that are established within healthcare right now and be part of that and be part of that entire continuum of care so that we can really anchor that.
Awesome, David. Thank you so much for sharing your hot take with us and having some fun with me. And thank you so much for joining me. I know that I've learned a lot from you, and I'm looking forward to what's coming from Medical Fitness Association. And just thank you so much for taking the time to share your insights with the industry.
It's my pleasure, and thank you for all the good work that you're doing to get some of this message out there and talk to the people who are doing it. I saw your roundtable, and that was excellent. A lot of those folks, I know they run awesome programming and operations of their facilities. Yeah, great job. My pleasure. I'm happy to come back whenever you like.
2031, mark it now.
That's right.